And Sheila, I still remember the very first session. I didn't say anything for the first hour. I didn't say anything. I fidgeted. I just sat there and I was playing with the tissue. I was playing with my shirt, the lower hem of my shirt. And I'm slightly OCD, so I have this finger thing that I do. And I was doing that. I did that quite a few times. And she just sat there patiently. She got up a couple of times to go get a fresh cup of tea. She didn't force anything. And that's when I started talking. And I talked, and I talked, and I talked, and I talked for the remainder of the half an hour. And then just as the session was ending, just as I was about to leave, this little tiny voice popped out of my mouth. And it was Nicky. Then Nicky was 6 years old. He's a little boy. And he was scared. He was nervous. He didn't know this person. Of course he's going to be scared. He had no idea where he was. And that's the life of an MP. Most of the time, 90% of the time, you don't know where you are when you don't have cooperation. You don't know what has happened. You can't explain the bruises on your body, and you can't explain the scars. And my body is littered with scars. And just slowly but surely I've gotten those memories. And I can honestly say that at the time, when I was 5 and the scars actually happened, I couldn't have handled it. I just could not have handled it without the constant breaking apart of my subconscious to take that type of abuse. I'm not saying that being MP makes you a better survivor. I'm saying that MP is just a different niche of surviving. And when you survive anything like that, whether you're MP or not, you are strong. You are so brave. And no one can take that from you. No one in this world can take that from you. You have moved on from something that was meant to break you, and you came out of it. How fucking awesome is that? Being MP is just a different page of the survival handbook. That's all it is. Through my therapy with Sheila, I was able to integrate a lot of people in that first year. A lot of people. I can't even begin to tell you how many people. I think I can honestly say that in the course of that first year, I integrated maybe 100, 105 people. And that's supposed to be the purpose of therapy when you're NP. That's supposed to be the point, right? You're supposed to integrate. I don't believe that anymore. As I've come to know the people within me, as I've come to accept them and see them for who they are and what they have to offer, I don't want to integrate them. I don't want to integrate the last 25 that I have. I don't think it's 25 anymore. I think I integrated a few more. Now, see, that's something that no one has been able to explain to me, is if integrating is a natural occurrence of therapy, or if you can control it. Now, if I can control it, that would explain why the ones that are still here, because they were the founding fathers, basically. If you start going through the process of realizing that you're NP, you're not alone. There are a lot of resources out there for you. There are support groups. There are therapists who are trained specifically in that field. Don't give up looking. When you call for a therapist, make sure that's the very first thing out of your mouth. Are they experienced with multiple personality disorder? I don't like this new dissociative identity disorder. That completely takes away from what it is. That's just basically saying that you don't know who you are. I have multiple personalities. I know very well who I am. Make sure you, when you first meet them, make sure you ask them, what kind of experience do you have? How many MPs have you treated? I think this may be what's happening to me. And don't let them steer you in a different direction, because some of them will, especially the ones that don't have any experience. You do not have to feel bad about not going back. It is not their time. They're at work. They're going to get paid whether you sit there or not. Somebody else is going to come in right behind you and fill that seat if you're not there. Don't let... Try to see a woman. Women are a little bit more empathetic about the therapy process. Men don't usually understand. They're trained to understand, but they don't physically understand. They have no idea what it's like for a woman to walk down the street and be in fear for her life. They don't understand that on the kind of level that a woman would. If you feel comfortable seeing a man, absolutely, by all means, this is your therapy. You have to be the one who is in control of it, not the therapist. Just also keep that in mind. You go as fast as and slow as you want. There is no time limit. There's no time frame. When you first start talking about the blackouts and the body memories and the nightmares, be prepared for the kind of emotions that it's going to stir up. It's going to be like you were there, experiencing it all over again, especially the body memories. I've had a lot of body memories. Body memories are classified as when your body remembers the trauma. There's a theory, I'm not exactly sure, I can't remember who came up with the theory, but there's a theory that your cells remember everything, that your cells actually have a memory. The cells in your tissue, the cells in your blood and your brain. It's true. I've had my scars, my old scars, just rip open, and it's terrifying. And people would think when they saw the scars healing again that I was a cutter, and I'm a puss. I don't like pain. I get a little sick, and I'm like the biggest baby on the planet. And there's no way that I could inflict that kind of pain on myself. I think I understand people who cut. I'll be honest, there's not 100% understanding of that. But if you don't like your body that much, and that's the only thing you can do to show your body you don't like it, that part I can understand. But as for me, I physically couldn't do it.